Alright, so we have now recently completed fungal infections, and before that, we covered bacterial and viral lesions here on Oral Medicine Simplified. So at this point, we have essentially completed all the major categories of oral infectious lesions. Now, instead of memorizing everything separately, let's simplify this into a clinical approach you can actually use chairside. So whenever you see a lesion, the first question you should ask yourself is, what pattern does this follow? Now, if the lesion appears white and it wipes off on scraping, your first instinct might be to think of candidiasis. And yes, that is a very common cause. But remember what we discussed in the last lecture. Not every wipeable white lesion is candidiasis. You should not blindly prescribe antifungals to everything that wipes off. There are other conditions that can present in a similar way, and this is where your clinical judgment matters. So instead of jumping to treatment, pause and correlate. Look for risk factors like antibiotics, steroids, diabetes, or immunosuppression, and confirm that the presentation actually fits a fungal infection. Now, if the lesion does not wipe off, shift your thinking. If you see vesicles that rupture and form ulcers, especially if they are painful or recurrent, then you're most likely dealing with a viral infection like herpes. And if instead of ulcers you see papillomatous or warty growths, then think of HPV. So for viral lesions, you're looking either vesicles turning into ulcers or exophatic growths. Now coming to bacterial infections. These are usually more straightforward. If you see pain, swelling, and especially pus or abscess formation, then a bacterial cause should be high on your list. And most of the time, there is an underlying local factor like plaque, caries, or trauma driving the infection. So if I simplify this for quick recall in the clinic, if it wipes off, think fungal, but do not assume. If you see vesicles or papillomatous growths, think viral. If there is pus, pain, and swelling, think bacterial. That is your framework. Now, not memorization, but clinical reasoning. And that is exactly the goal of Oral Medicine Simplified.